Hello, my name is Madison Sant, and I'm from AREP Laboratories Parasitology Department. This presentation will cover blood parasites including trypanosomes, leishmania, and mycofilariae. Please fill out the parasitology practice worksheet while listening to the lecture. Feel free to pause the lecture to take your notes. Write down any questions you may have so that we can discuss them when we meet in person. If we will not be meeting in person, I would suggest talking to your professor about any questions you may have. The organisms we will discuss are trypanosomes, leishmania, and mycofilariae. The stain commonly used to detect other blood parasites is the Giemsa stain. Thick and thin smears are made from whole blood and EDTA. The thick smears are used to detect the presence of the parasite, while the thin smears are used for species-level identification. We will discuss two different types of trypanosomes, Trypanosoma cruzi and Trypanosoma brucei. Trypanosoma cruzi causes Chagas disease, which is endemic to the American tropics. An infected triatomine insect vector, or kissing bug, takes a blood meal and releases tryptomastogotes in its feces near the site of the bite wound. Tryptomastogotes enter the host through the bite wound or through mucosal membranes such as the conjunctiva. Inside the host, the tryptomastogotes invade cells near the site of inoculation, where they become intracellular amastogotes. The amastogotes multiply by binary fission and become tryptomastogotes, which are then released into the circulation as bloodstream tryptomastogotes. Tryptomastogotes infect cells of various tissues and transform into intracellular amastogotes in new infection sites. The kissing bug becomes infected by feeding on a human or animal blood that contains circulating parasites. The ingested tryptomastogotes transform into epimastogotes in the vector's midgut. The parasites become infected metacyclic tryptomastogotes in the hindgut. Other less common routes of transmission include blood transfusions, organ transplantation, transplacental transmission, and foodborne transmission by food or drink contaminated with a kissing bug and its feces. Chagas disease has an acute phase and a chronic phase. The acute phase is usually asymptomatic but can present with nonspecific symptoms. Nodular lesions or furuncles, usually called trichomas, may develop around the vector's feeding site. Trichomas occurring on the eyelids are commonly referred to as Romana's sign. The chronic phase may include cardiac and gastrointestinal involvement. Amastogote invasion of smooth muscle can lead to megaesophagus, megacolon, and dilated cardiomyopathy. Complications of chronic Chagas disease may be fatal. Amastogotes of Trypanosoma cruzi can be found in tissue and have one nucleus and a kinetoplast. Tryptomastogotes are 12 to 30 microns and have a large kinetoplast, a centrally located nucleus, an undulating membrane, and a flagellum running along the undulating membrane, leaving the body at the anterior end. Tryptomastogotes can be seen in peripheral blood and in cerebral spinal fluid and central nervous system infections. African trypanosomes include two subspecies that are morphologically indistinguishable: Trypanosoma brucei gamenense, causing chronic African trypanomyosis or West African sleeping sickness, and Trypanosoma brucei rhodense, causing acute African trypanomyosis or East African sleeping sickness. Trypanosoma brucei gamenense is endemic in West and Central Africa. Trypanosoma brucei rhodense is restricted to East and Southeast Africa. During a blood meal, an infected tsetse fly injects metacyclic tryptomastogotes into skin tissue. The parasites enter the lymphatic system and pass into the bloodstream. Inside the host, they transform into bloodstream tryptomastogotes, which are carried to other sites throughout the body and reach other body fluids, including lymph and spinal fluid. The tryptomastogotes replicate by binary fission. The tsetse fly becomes infected with bloodstream tryptomastogotes when taking a blood meal on an infected human host. In the fly's midgut, the parasites transform into procyclic tryptomastogotes, multiply by binary fission, leave the midgut, and transform into epimastogotes. The epimastogotes reach the fly's salivary glands and continue multiplication by binary fission. Infection occurs in two stages, which may sometimes be preceded by the development of a chancre at the site of inoculation within days of being bitten by the infected fly. First stage disease involves nonspecific signs and symptoms such as intermittent fever and lymphadenopathy. Winterbottom sign, which is the enlargement of cervical lymph nodes, is commonly seen in Trypanosoma brucei gammonese. In the second stage disease, invasion of central nervous system causes a variety of neuropsychiatric manifestations, including sleep disorders. Trypanosoma brucei tryptomastocytes have a small kinetoplast located at the posterior end, a centrally located nucleus, an undulating membrane, and a flagellum running along the undulating membrane, leaving the body at the anterior end. Tryptomastocytes are the only stage found in patients and range from 14 to 33 microns. Next, we will discuss leishmania. Leishmaniasis is found in parts of about 88 countries. Most of the affected countries are in the tropics and subtropics. Leishmaniasis is transmitted by the bite of infected sandflies. The sandflies inject the infective stage promastocytes during blood meals. Promastocytes that reach the puncture wound are phagocytized by macrophages. Promastocytes transform in these cells into tissue stage or amastocytes, which multiply and proceed to infect other macrophages. Sandflies become infected by ingesting infected cells during blood meals. In sandflies, amastocytes transform into promastocytes, develop in the gut, and migrate to the proboscis. Leishmaniasis has three main clinical syndromes: cutaneous, mucosal, and visceral. Infections can result in two main forms of disease: cutaneous leishmaniasis and visceral leishmaniasis, or Kali-Alzar. Cutaneous leishmaniasis is characterized by one or more cutaneous lesions on areas where sandflies have fed. Persons who have cutaneous leishmaniasis have one or more sores on their skins. Persons who have visceral leishmaniasis have fever, weight loss, and a large spleen and liver. Leishmania amastocytes can be recovered from aspirates, lesion punch biopsies, or bone marrow and stained with Giemsa stain. Blood is not the specimen of choice for leishmania detection. Amastocytes of leishmania are round to oval and measure 1 to 5 microns. They have a large nucleus and a prominent kinetoplast. The organisms reside in macrophages of the host and can be found throughout the body. Now we're going to briefly discuss the most frequently encountered mycofilaria: Wuchereria, Brugia, Loa Loa, and Mancinella. Mycofilaria are vector-borne diseases. The vector injects the larvae into the skin, where it develops into adults in various body sites, the location of which depends on the species. Adults produce mycofilariae that can be found in peripheral blood. Wuchereria bancrofti is found in tropical and subtropical regions. It is transmitted by Anopheles, Culex, and Aedes mosquitoes. Symptoms include Bancroftian or lymphatic filariasis, which may progress to elephantiasis. Brugia malayi is found in India, Asia, and Southeast Asia. It is transmitted by Mancini, Anopheles, and Culex mosquitoes. Symptoms are similar to Wuchereria bancrofti, but are often milder. Loa Loa is found in Central and West Africa. It's transmitted by mango flies and deer flies, the chrysop species. And symptoms include migratory angioedema, caused by adults moving about in subcutaneous tissue. Loa Loa also causes eye worm, which is where adult worms are recovered from the conjunctiva. Mancinella persistans is found in Africa, the West Indies, and Central and South America. It's transmitted by biting midges of the Culicodes species. Symptoms include migratory angioedema, pericarditis, and adult worms reside in body cavities. Mancinella oryzardi is found in Central and South America. It's transmitted by biting midges of the Culicodes species and black flies of the Simulium species. Adult worms are found in body cavities and usually is asymptomatic. It is useful to compare the tails of mycofilariae to help identify the species. Wuchereria bancrofti is 240 to 300 microns in length. The tail is pointed with no nuclei. When the sheath is present, it usually does not stain. Loa Loa is 230 to 300 microns. The tail is tapered, with irregularly arranged nuclei that extend to the tip of the tail. So I like to say Loa Loa floas to the tip of the tail. When the sheath is present, it usually does not stain. Brugia species are 175 microns to 310 microns. In the tail, there are two nuclei, a subterminal and terminal nuclei. The sheath, when present, may be bright pink or may not stain at all. Manslaughter Zardi are 160 to 240 microns. They have a long tail that are pointed with no nuclei at the tip. The sheath is always absent. Manslaughter persans is 190 to 230 microns. Has a blunt tail with nuclei extending all the way to the tip. The sheath is also absent. Several of the images and life cycles are courtesy of the Centers for Disease Control and its Laboratory Diagnostic Assistance website, DPDX, and Traveler's Health website. Other images I have taken while working on the bench at ARUP Laboratories.